is Makena Kraft. I am a BSN. I have my Bachelor's of Science in Nursing. I'm a registered nurse. I'm certified in inpatient obstetrics, and I'm also an oncology certified nurse. I worked in labor and delivery for 6.5 years out of nursing school. That was my first nursing job. Before COVID happened, my unit was starting to not, do well. Administrative shakeups, and then COVID happened, and it just exacerbated the problem. You hear about it in nurses all the time, the burnout and the, looking for other jobs outside of healthcare. I remember one of my old coworkers, her brother was a crane operator and making more than I was making an hour in labor and delivery. And I said, great, I'm gonna go be a crane operator. And then I decided, no, let's just try a different area of nursing. And so I applied at Fred Hutch, and on the clinical trials unit, I was interested in research, but I never saw myself as a researcher. So I got hired there, and I realized this is my jam. I already had a great experience here in my ABSN program, and so it just was the logical option for me. My area of interest is delivery system design, and so not solely focused on patient outcomes, but how can we as nurses, as the extended healthcare community of providers, how can we work better together, work more efficiently, which then in turn would lead to better patient outcomes. To not have to worry about paying tuition and to have the stipend and the health insurance takes so much pressure off, and I'm able to really focus on my studies when I'm here. I'm able to focus on my family and not have that sense of worrying about paying my bills and worrying about paying for my son's preschool, and so thank you so much.